Good morning. I'm Scott Harrah, Director of Digital Content at UMHS, and today we're speaking with 2016 UMHS graduate Dr. John Trangucci. And good morning and welcome today.
Good morning, Scott. Thank you for having me. Excited to
Yes,
be here.
thank you for speaking with us. Dr. Trangucci, can you tell us a little bit about what you're doing right now and how you obtained your upcoming plastic surgery in Temple University?
Yeah. So I'm currently about to start my plastic surgery fellowship at Temple University Hospital in a couple of weeks. I just graduated from my general surgery residency at UPMC Harrisburg Hospital in Harrisburg, Pennsylvania. Um, it's been a long road, but it's been one that's been very, very fun and rewarding, and something that I do not regret one bit. Um, I am initially from New Rochelle, New York, which is actually one of the sixth. It's actually the sixth largest city in the state of New York. It's right outside the Bronx. I come from a family of no physicians, no lawyers, and initially my goal was to be a pro baseball player.
Wow.
I wanted to play center field for the New York Mets. That was my goal. I played throughout my childhood. I had a batting cage in my backyard. Baseball is what I slept, ate, and breathed. I played for my high school and ultimately got a scholarship to play for a Division II school in college. And shortly after starting college, I realized that I was good, but I wasn't great, and I wanted to pursue a career in medicine. And I forfeited my athletic scholarship and ultimately obtained an academic scholarship and began focusing my attention on pursuing my dream of becoming a physician. Um, and then I worked through college to position myself to get into medical school. And UMHS is an institution that will always have a special place in my heart. I always tell people they're the one that gave me the shot to achieve my dream. I applied to several American medical schools, and some I did not get into, some I was waitlisted on, and I was kind of bummed out. I didn't know, if my dream was going to come true. I didn't know if I was ever going to get an acceptance into an American med school. I was looking at doing some of those master programs, but then um, I was looking into some of the Caribbean schools, and UMHS was very similar to my undergraduate school. Small classes, kind of personalized education. Um, and the admissions director at the time who I met was incredible. And I said to myself, this is where I want to be. These are the people that I feel would help me achieve my dream and seem like they would cultivate a good learning environment. And that's why I chose UMHS. And they have been the ones who have allowed me to achieve my dream, and I'll never forget that, and I'm indebted to that.
So, how did you get into plastic surgery? What made you become interested in plastic surgery?
Yeah, so I've always been into surgery. Surgery was something that I've always had an interest in. And in the summers of my freshman and sophomore year of college, I actually had the opportunity to work in the operating room at the hospital in my city, New Rochelle. And I got to observe several surgeries. I saw a cholecystectomy, I saw a total body lift, um, and I just fell in love with surgery there. As I was going through medical school, I got to scrub in on a couple of plastic surgeries, including an orbital floor blowout repair, a tummy tuck, and I said, "Wow, I mean, this is pretty interesting." You know, in one respect, you're helping people look better when you perform a cosmetic surgery. In other aspects, you're actually performing reconstructive surgery following trauma, and you're working from head to toe. You work on all parts of the body, every aspect. There's no limitation. It's not like you're only working on the chest or the abdomen. You can work on any part of the body that needs to be repaired. You also get to operate and work with adults and children, which is kind of unique compared to other types of surgery. And then honestly, too, having myself had a cosmetic procedure, having had a hair transplant about 6 years ago, that also kind of made me see the impact that it has on patients. And I said, well, who else could be a better advocate than somebody like myself who's had one of these procedures before and has seen what it can do for your confidence. And that's kind of what kind of pushed me to pursue plastic surgery.
Okay, so you actually had experience with
Yep.
plastic surgery, having a hair transplant, and it's a
Yep.
confidence builder. And I think that's so important because a lot of people just think of plastic surgery as something for vain people, but
Exactly. And it's not. And
there's
it's
a
not.
lot of
And
yeah, there's reconstructive surgery after cancer or an accident, or what are the some of the things that excite you the most about the field of plastic surgery?
I mean, I think that it's always on the leading front of advancing technology and and the fact that they're always trying to kind of push the limits. Right now, one of the new big fields within plastic surgery is gender reassignment surgery.
Right.
That's a newer field within medicine, and Temple University actually is doing a lot of that right
Oh
now.
wow.
So I'll be able to have some experience with that, and being able, again, being able to, help change people's lives and make them feel whole, right? People always say, "Oh, plastic surgery is like you said, right? Is for those who are vain and they just want bigger lips, or they just want that change." But that's not necessarily the case. Cosmetic surgery for those particular patients is a very, very kind of small percent of the patients who receive surgery, right? With gender reassignment surgery, with patients who have breast cancer and who have had their breasts removed, had mastectomy, and require breast reconstruction, that's plastic surgery. Um, Cranial facial surgery, like cleft lips and cleft palates, is also done by plastic surgeons. Cranial facial trauma. So, like I said, people that have had sports-related accidents, injuries to their orbit, fractures to their orbit, plastic surgery deals with nasal fractures. So it's very broad, and it's as you can kind of get an idea from it. You work on every aspect of the body, and that really, really attracts me to the field. And I think it's personally, I think it's the best field out there, and I would
Uh,
encourage everybody to go into it.
Great. And anything else that you'd like to say about plastic surgery?
I mean, I think to all the prospective students, you might hear that it's out of your reach. You might hear that it's impossible to get into, especially coming from the Caribbean. But I want to tell you guys that it is possible, and never forego your dream. If this is what you want to do, you work at it as if you know it's like the air that you need to breathe. Don't give up. Always try to network, work your hardest, make connections, and don't listen to all the naysayers, because I will tell you, if you tell people that you want to do plastic surgery, you're going to hear it from a lot of them.